Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Parkinson's disease can impact every aspect of a person's life as they battle the shaking, stiffness, and difficulty moving. When medications are not enough or the side effects are too great, deep brain stimulation may be an option. And joining us to talk about the procedure and how it works is Dr. Matthew Boyce, Medical Director of the Deep Brain Stimulation Program at Chippenham and Johnston-Willis Hospitals. So, the first question is, how common is this procedure? It sounds pretty intense.
Sure, deep brain stimulation does sound pretty intense. It's not the first line therapy for a patient with Parkinson's disease, but once you've been through some of the medications and you're starting to have maybe side effects because the dosage has been increased to a certain point, or the medicines aren't lasting as long to control the symptoms of tremor, stiffness, slowness, the life of a person who's dealing with that gets more complicated, and then you start to seek other options. Deep brain stimulation is a fantastic option for a patient who's dealing with those fluctuations in their symptoms, and by placing this electrode in the brain, we're able to control those symptoms more steadily throughout the day and reduce medication potentially.
That was the next question I was going to ask you, is what's involved in the procedure?
Well, basically what's involved in deep brain stimulation is that we put an electrode or a wire into the brain, into a circuit that is causing the symptoms of tremor, stiffness, and slowness. And by blocking that circuit, you're able to alleviate those symptoms and reduce those symptoms, thus alleviating or reducing the need for medication.
That was the other thing I was going to ask. So would this reduce the need to take pills or any type of medication?
Well, absolutely. Certainly deep brain stimulation allows us to reduce medication. It varies in terms of the amount of reduction. Some people might see a 50% reduction in medication. Some people come off medication altogether. So there's a little bit of variability there.
That's a big deal.
Yeah, it is.
The other question then is, if you can come off medication, who's the ideal candidate though? Can everybody do this?
Well, the ideal candidate is someone who has a clear-cut diagnosis of either essential tremor or Parkinson's disease. Talking about Parkinson's disease specifically, someone who's having a lot of side effects, motor fluctuations, meaning their medicines wear off or don't last very long, and that's having a fairly negative impact on their quality of life.
These things sound good, and then they start naming off all the side effects of the procedure.
Sure.
Are there side effects of this procedure?
Well, like any surgical procedure, there is risk. The risk is small. There's about a 2% risk of causing symptoms like a stroke because we're putting this wire into the brain. Like I said, those risks are low. With any surgery, there's risk of infection. But once you get the procedure done and the electrode's in, it's in and it's sort of running constantly, and there isn't a lot of negative that comes beyond that. Certainly no side effects like you get with medication.
Well, thank you so much for joining us today, Dr. Boyce.
Sure, no problem. Thanks, Chris.
Good information.